So many times patients want to come in and they want to have a better smile, but all they think is, I want them to be white and straight. And that's a good start, that's a good foundation, but there are some more detailed things that we'll have to consider. So I put together this 4-part series called the Cosmetic Quadrant. So we're going to talk about the 4 main areas that we as dentists look at when we're trying to fix someone's smile, or at least let them know what can be done to improve it. So I'll go over that quadrant right now. We're looking at 4 things: color, position, shape, and quantity, or how many teeth are in the smile. And so we're going to focus today in this video on color. And so color, we start with, would be yellow or dingy teeth. This is when patients, maybe over time, teeth have gotten a little bit more yellower, if that's even a word, than what they used to be. That just happens from things that we eat and drink and so forth. But that can be fixed by first coming and getting the teeth cleaned. Sometimes it's just simply that, just to get some of that outer layer off the teeth. But beyond that, we can do something called bleaching, or you might have heard it called whitening. And that's where we can have custom-made trays made just specifically to fit on your teeth. And inside those trays, we can put some gel, and that bleaching gel gets in there and helps whiten the teeth. We can also do a take-home, which the take-home trays are, plus an in-office whitening, and together, those can really help brighten up the teeth as well. So you see in this example, this is just a regular patient with, they can just be a little bit brighter teeth. And they're very healthy teeth. There's no cavities, there's no problem there. They just need to have them bleached. And so that'd be a great example of a good case for that. There's also discolorations that can come from teeth that might have some stripes going across them. Here you can see, in this individual, they have kind of up here a more of an orangish color, and then you get on this other part of the tooth that's a little bit more of a gray color. That is when this patient was smaller than when they were a child and they were developing these teeth. They may have been ingesting different things like tetracycline or other medications that will lay down this coloring inside the teeth. Now, these teeth are a little bit more resistant to bleaching. The bleaching agents just have a harder time getting deeper into the teeth, but it is something that can be improved with whitening. But most of the time with cases like this, we end up putting porcelain coverings over the front of the teeth that kind of help block out that white stain, or those dark stripes with some white porcelain that goes over the top of them. We may also have a patient that comes in, they just have one tooth that's dark. And now this can happen when a tooth is dead, we call it, meaning that the nerve and the blood supply inside the tooth is no longer there. And so the tooth is just not its usual vital, healthy self. And so what needs to happen with these types of cases is the inside of that tooth has to be cleaned out, and we put bleach actually on the inside of the tooth. So the tooth bleaches from the inside out. And so that's a very simple process as well. Or, and this is the very same picture, person could present with this exact same problem, but instead of the tooth being dead or the nerve no longer being there, the canal, the little tube that goes through the tooth, could have become calcified shut. And so what happens with that is we can't bleach that tooth from the inside out. Instead, we have to do, like we did with those striped teeth, we have to put a covering over the front to kind of mask that discoloration. We also have patients that come at a time and the color of the teeth gets kind of spotty. They might have yellow spots or they might have white spots. And these can be superficial stains that we can sometimes buff out. We might be able to take that little spot and remove just that layer and put in a composite filling, a tooth-colored resin. Or they could try to bleach them brighter. Or if they're kind of more advanced, they may need some veneers. That's that porcelain covering that goes over the front of the teeth to correct that color issue. We can also have color problems that come from cavities. Over time, cavities become dark, and so they can leave these dark spots on the teeth and between the teeth, up by the gum line. And of course, we all know that with cavities, we fix those with fillings, and we have tooth-colored fillings that help correct this color problem. Next, we can have old fillings. You can have fillings that were done a long time ago and the edges are starting to break down. That's where some discoloration can come from. And we can just remove those old fillings, clean them up, and then put in new fresh fillings that blend in really well with the teeth. We also might have a patient that comes in that has a dark line up at the gum line, and that's going to be from previous dental work that was done. And again, we can look at some updated materials to get rid of some of those old metallic restorations and put in something that's 100% metal-free that's going to blend in better with the smile. And then lastly, we have patients that come with these little chalky white spots. We typically see this in individuals who had braces, and then while they're wearing the braces, they had a hard time cleaning right up between the bracket and the wire and the gum line. That area just always had plaque sitting on it, and over time the teeth become decalcified and leave behind these white spots, and sometimes those even lead to cavities. And so in those cases, we have to go clean out that outer layer and fill it in with composite resin. So you can see when we talk about a smile, the color of the teeth, of course, are very important. So we might be talking about generalized issues, or we might be talking about a very specific tooth or a couple of different teeth. And there's ways of fixing it, whether it be with bleaching, fillings, or veneers. Typically are the three things that we're going to be working with to help fix those problems. So that's part one of the 4-part quadrant on cosmetic dentistry. Thank you.